Good evening, everyone. Without further ado, let's get into the discussion of exercise and pain. And before we go further, just want to mention that I have no disclosures related to this topic. So we're going to review health benefits from regular physical exercise. We'll touch base on the definition for chronic pain, and then look at exercise as a treatment for pain. We will review types of exercise, evidence of benefit, of which we'll give a general overview. We'll cover some potential adverse effects of exercise to keep in mind. And then we'll conclude with recommendations that are a little bit more specific to exercise and the treatment of chronic pain with exercise as a component. So there's lots of information that one could find on exercise and physical activity related to health, all sorts of web-based references and books and whatnot. But this is actually one really great place to start if you're going to choose one. And that's the Physical Activity Guidelines for Americans. Came out in 2018. This is the article in the Journal of American Medical Association that was published at the same time when the book itself was published. And it reviews physical activity from a very broad lens. It reviews it as related to the arc of life, making recommendations from childhood all the way through adult life and into the later years, and then also provides science of how physical activity benefits our health, looking at all sorts of metrics, including mortality, major disease forms in terms of cardiovascular disease, hypertension and diabetes, reduction of risk for cancer, also towards cognitive and emotional health, reducing the risk of anxiety and depression, improved sleep. The list goes on and on. So it's a great reference. You can also obtain the larger full publication as well. And this was put out by the Department of Health and Human Services. And when they did this, they also started a campaign to help promote these recommendations. So before I move on with the slide, I want to point out that there's a QR code at the lower part of the screen. So please take a moment to bring out your phone and open up the camera and click on that so that you can get that reference to look back at later. And I'll have some more QR codes throughout the discussion this evening. I'll give you a second just to do that before we move on. Okay, so this is actually the corollary campaign that they did for the physical activity guidelines. And it points out a couple of key factors in terms of what they're considering is beneficial when it comes to physical activity. They note the types of activities in terms of aerobic and muscle strengthening, for example. They note the amount of activity and the intensities of those activities. We'll get more into this as the lecture goes on. But again, before I move forward, if you want to take another opportunity to get this reference, go ahead and scan that QR code. All right. So now let's shift gears a little bit and talk about chronic pain. First of all, what is chronic pain? Well, it has a definition. We define it as a pain that lasts more than 3 months and is defined by the International Association for the Study of Pain as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. A key factor to this is that it's pain that is perceived without the acute nociceptive triggers. And a key component to that is the process of central sensitization, which occurs through local and systemic inflammation, and is a process where the peripheral nervous system sends more pain signals up to the central nervous system. These are bottom-up changes, but then also the brain and spinal cord are sending less inhibitory signals down. So we have changes throughout the entirety of the nervous system. In terms of prevalence, studies vary widely in terms of the prevalence of chronic pain, largely depending on differences of definition. But the point is, it's extremely common, not only in the United States, but also worldwide. So how does exercise work potentially as a treatment for chronic pain? Well, it does this in a number of different ways. The first is through a rebalancing, if you will, of inflammation. There are pro-inflammatory cytokines and there are anti-inflammatory cytokines. And getting these back into balance can help prevent hyperalgesia. And hyperalgesia is an increased sensitivity to feeling pain and an extreme response to pain, which is very common in chronic pain conditions. Another way that exercise acts as a treatment mechanism is through exercise-induced analgesia while someone is exercising or in the immediate period afterwards. Exercise itself triggers the release of endogenous analgesics, particularly endocannabinoids during exercise at moderate to slightly vigorous intensities. At very vigorous intensities, endogenous opioids are also released. In addition, there is modulation of multiple neurotransmitters throughout the central nervous system, which we'll come to and speak of more in just a moment. There's upregulation of central pain inhibitory pathways, particularly in the spinal cord. And then there are the effects on other neurotransmitters, such as serotonin, dopamine, and norepinephrine, which may be imbalanced in the setting of chronic pain and may gain a rebalance through exercise. And then there are also other effects, specifically on the brain, one of which is to rebalance the thought processes around movement. Specifically, in some patients who have chronic pain, there is often fear linked to the ideas of movement, call this kinesiophobia. And exercise itself can help rebalance this by refocusing and sharpening the body schema maps that are found in the brain to reduce pain via a cortical reorganization. Exercise promotes cognitive restructuring by decreasing pain catastrophizing and also improving self-efficacy, which is a process of systemic desensitization. Okay, so we got kind of in the weeds there on pain with it with exercise as a treatment for pain. Let's shift gears a little bit, and now we'll give an overview of different types of exercises that one may look at or want to engage in during the treatment of pain with exercise as the modality. So the first would be standard endurance training. This could be walking, hiking, running, cycling, swimming, basically a repetitive muscular motion that is going to cause increase in heart rate, increase in the cardiorespiratory effort. The next type would be traditional strength training with focus on promoting muscle growth. This would include weightlifting and training via resistance equipment, such as training with bands. And also, before I move on, I want to note this kind of disclaimer at the bottom that I've put, which is that not all types of exercise are suitable for all types of people or compatible with all pain conditions. There are many different types of pain conditions, and depending on the type that you may have, multiple or perhaps specific ones of the types I'm mentioning may not be appropriate for you at this point in time. So the next type would be high intensity interval training, which involves intermittent, usually regularly timed bouts of high intensity activity that, because they are stacked, are able to create a sustained aerobic workout in addition to the muscle training that is going on. Another category would be dynamic flexibility training. This is kind of a broad catch-all category that involves yoga, Pilates, Tai Chi, but also other types of exercise such as Zumba, or ones that would focus on improving mobility in particular, in addition to muscular endurance. A little bit more on that, because some of those do have a more specific role in the treatment of chronic pain. One would be yoga. Yoga is a practice of breathing and mindfulness, spirituality, and the connection of body and mind, with three main components being postures, which are shown over on the right-hand side of the screen, breathing exercises, and then also meditation. Yoga may improve multiple parameters of health and quality of life, well beyond the scope of the discussion of treatment of pain. Another is Tai Chi, which is a form of mind-body exercise that originated in China, involves martial arts, meditation, and dance-like movements that focus on mind-body connection, but also are, by virtue of how they're performed, integrating components of flexibility, balance, and to a certain extent, even endurance. Another category of exercise would be that which is a mixture of strength and aerobic training, somewhat more like what you would find at many gyms or fitness classes. Examples would be body pump or CrossFit, Orange Theory, or so-called boot camps. Generally, they're involving some form of resistance training and are targeting most often all major muscle groups while using relatively short recovery periods and continual activity to work the aerobic system. So this has, in concept, some overlap with HIIT training. It's just that HIIT training tends to be even more intense with those specific efforts and for a shorter total duration. The last category that we'll bring up is functional fitness training. And this is a form of exercise that involves training the whole body for the activities of daily life. There's an emphasis in performing exercises for both the upper and lower body at the same time, while emphasizing core stability, much as shown in the depictions at the bottom of the screen. And this is a slide from the campaign that we were looking at earlier from Move Your Way. I love it. It's great. I think the message that they're showing is fantastic. And the quote is, "Forget the treadmill, I'd rather show off my dance moves." Doing an activity, an exercise which one enjoys is going to be extremely important in terms of the consistency. And as we move forward, before we go into further recommendations, I want you to keep this, and we'll circle back to this, but I want you to keep this in mind. And that this is that as you think about exercise, reflect on these principles. Endurance then strength, a little intensity, integrate balance, and last, consistency is key. Do what you enjoy, start slow, and importantly, embrace guidance and supervision. This can be in many different forms. Physical therapists play an extremely important role in the treatment of chronic pain, and very specifically in helping individuals begin and continue in exercise programs that are appropriate for them in the treatment of chronic pain. But there are also other individuals that can be very helpful when integrating exercise. For example, clinical exercise physiologist, a coach, a pain psychologist, your pain medicine physician, and also, and importantly, your primary care provider. So let's touch upon a few adverse effects of exercise. Exercise is a physical stressor. Tolerable physical stress and adequate rest recovery is what we're shooting for. But excessive physical stress can actually increase pain sensitivity. Temporary flare-ups of symptoms after exercise can occur for some people to a greater degree when they have a chronic pain condition than in individuals who do not. And this is a combination of the known effects of exercise in terms of production of lactate, protons, and ATP utilization. But in those patients who are more sensitive, this may actually be a little bit more problematic. With very intense exercise, actual myofiber damage can happen, but one has to be exercising quite intensely for that to occur. And even that, though uncomfortable, is temporary. Last category to kind of be aware of is that cardiorespiratory complications can occur, and those can be serious, but they are also rare. And so before starting any exercise regimen, it's best to do so under the supervision of your doctor. Okay, let's shift gears a little bit again and review some literature regarding physical activity as a treatment for chronic pain. So there's a lot to be found out there. This is a great place to start because of the broad scope of this study. As a Cochrane review, they reviewed 381 different studies with 37,000 participants. Ultimately, they included 264 studies with almost 20,000 participants. They examined exercise versus essentially no exercise or minimal intervention in adults with chronic pain for analysis. The interventions varied quite a lot, actually, in terms of whether it was aerobic-based or strength-based, whether it was focusing on flexibility, or whether it was a very specific type. For example, if it were just looking at yoga, just Pilates or Tai Chi. So because of this heterogeneity, and then also the fact that most of these studies were small, and with what they defined as a relatively short intervention on the order of days to weeks, and relatively short follow-up on the order of just months, rarely beyond 3 to 6 months. For this reason, they determined that the quality of evidence was overall low. That being said, the reviews noted favorable results from exercise in an overwhelming majority of the studies. There were only 3 that didn't. But the results were inconsistent in terms of what actually was shown to be beneficial. In terms of, for example, did it actually reduce pain itself at any single time point? And indeed, most studies did not consistently bring out that specific metric as a benefit. But what they did find was that function was significantly improved in a significant number of the studies, even if those were only small to moderate effect sizes. But this was important because it has implications for psychological function and quality of life. Adverse events were, although not always reported across the different studies, they were rare, and they were generally just increased soreness or muscle pain that was temporary and subsided after at most a few weeks. There was only one review that reported a death, and in all of the other ones, exercise was protective against death. So as we conclude here, I want to make some recommendations towards the use of exercise in a treatment regimen for chronic pain. And that is that it has a distinct place in the multimodal treatment of most conditions associated with chronic pain, even though the direct benefits of exercise itself may be small as specifically related to pain. There's tremendous, however, indirect benefits of exercise in terms of cardiovascular fitness, having a healthy BMI, and also a sense of well-being. It can contribute significantly to reduce disability in a large variety of diseases. In fact, diseases that are the most common. Any exercise program for chronic pain should begin with an individual assessment of the patient's overall health and fitness. And it should be thought through carefully in terms of what the quote unquote prescription would be, the mode, the intensity, the duration of the exercise session, the frequency of the exercise session, and when to increase the activity level. When one is thinking about how to go about designing the regimen, again, it's important to be doing what one enjoys, but it's also important to think about, does it actually address cardiovascular fitness? Does it address muscle strength, balance, and flexibility? Also, during exercise, individuals with more distress and those prone to catastrophizing, low mood, etc., can benefit from higher levels of supervision. Again, that supervision could be physical therapist, could be exercise physiologist, could be a coach, could be pain psychologist given this setting. So those individuals benefit from understanding that the reassurance that their tissues are structurally sound and that they can continue with exercise. Individuals with chronic pain should have as much control as possible in choosing their exercise. People who are more likely to participate in exercise programs designed with consideration of their circumstances, fitness levels, and exercise experiences. So once again, coming back to the concept of doing what you enjoy, starting slow, and embracing guidance and supervision. In addition, an individually tailored cognitive behavioral therapy program that assesses and addresses individual beliefs around pain and physical activity, combined with exercise training, is a promising strategy for patients for whom exercise may be even more challenging, such as those with fibromyalgia or other chronic pain conditions. Any amount of movement is preferable to none. Also, exercise doesn't replace other aspects of a holistic pain treatment regimen. So those being pharmacological, essentially surgical, or other non-pharmacological treatment modalities when indicated. So coming back to the recommendation from earlier, endurance, then strength, a little intensity, integrate balance, and consistency is key. So with that, we'll conclude.